10 and 32. Those are the normal number of baby or primary teeth and our adult or permanent teeth. But some people are born with extra teeth. They're known as supernumerary or hyperdontia. They often lead to delayed eruption or malpositioning of permanent teeth and general crowding, which is why it's important to detect it early and treat them in a timely fashion. So, what are supernumerary teeth and where do they occur most often? And how do we diagnose and treat them? I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. Supernumerary teeth or hyperdontia are dental anomalies that are characterized by excessive number of teeth. They may be hereditary or related to certain syndromes, but they can also happen in otherwise totally healthy individuals. Now, one of the questions is, why do supernumerary teeth occur? It is thought to be the result of a hyperactivity of what is known as the dental lamina. And dental lamina is one of the earliest morphological structures of tooth formation in embryo. Now, there are several common types of supernumerary teeth. One of the most common types is known as a mesiodent. Mesiodent is when a supernumerary or an extra tooth develops between the upper central incisors. It's often a small peg-shaped tooth that develops right behind or toward the palatal side of the upper central incisors. The second most common type of supernumerary teeth occurs in the premolar region, whether upper or lowers. As we can see in this patient, the permanent premolars are developing here and here, and we have an extra premolar supernumerary tooth developing. We can see this better in the cross section as well as the three-dimensional view. The other common type of supernumerary teeth occur in the wisdom teeth or the third molar region. As we can see in this patient, here's an impacted wisdom tooth, and there's an extra or supernumerary tooth developing right behind it. And we can see that in different sections in the cone beam CT scan of this patient. And sometimes they occur in combination. You could have a patient such as this that has a supernumerary or extra tooth in the premolar region, but also has a supernumerary or extra tooth in the wisdom tooth area. Another form or a condition where supernumerary teeth occur is known as odontoma, specifically compound odontoma. And odontoma is a benign condition characterized by a collection or a number of extra or supernumerary teeth that occur in one area. Again, this is benign. But one may find either 3, 4, 5, or even more number of extra teeth which are malformed and don't quite resemble actual teeth, but they have the structure of teeth, again, in one location. And that is one of the conditions that we find quite often. Now, the question is, what is the problem with supernumerary teeth? Really, the main issue is their impact on the permanent teeth. They may cause either failure or delayed eruption of the permanent teeth. They can result in their displacement. They can result in crowding. And also, if left alone, they may result in some forms of pathologies such as cysts. So it is very important that we diagnose and treat it as early as possible. Now, how do we diagnose it? From a clinical standpoint, one of the first indications that there could be a supernumerary tooth is the delayed eruption of the permanent teeth. Here's an example of a patient which has their central incisor, lateral incisors, and other teeth erupted. However, the other central incisors appear to be not erupting and missing in position. So one has to question whether or not there is a delayed eruption, perhaps being blocked by the supernumerary tooth. Now, there are several imaging techniques for diagnosis. Use of a regular dental periapical x-ray and panoramic x-ray are quite common and usually provide the first indication that there may be an extra tooth in development. However, because these x-rays are two-dimensional in nature, they really don't provide the spatial or the three-dimensional view or the exact position of the extra teeth. And sometimes they can transpose with other teeth, making it difficult to actually see it very clearly. So the other imaging technique known as cone beam CT scan is really the mainstay or the preferred way of imaging for proper diagnosis of supernumerary teeth. So we know that for accurate diagnosis, a cone beam CT scan is required. It's the most effective and helpful way to really understand the number of teeth that have developed already, the position and the number of supernumerary teeth, as well as what is the best approach for their removal. So here's a cone beam CT scan, and here's an example of a patient, and we can really accurately localize the different teeth in formation. Here we can see the primary canine, we can see the permanent canine, and we can see the collection and number of the supernumerary teeth in different views and different planes, so that when we form a surgical plan to remove the supernumerary teeth, we know absolutely with accuracy what to remove and what to leave behind. So what is the treatment sequence for supernumerary teeth? How do we treat these conditions? Primarily, the teeth most of the time can be accessed using pretty much a micro incision through the gingiva. In many situations and circumstances, the supernumerary teeth are fairly accessible, again, depending on the age of the patient and the state of development. So a micro incision for access, using minimally invasive techniques to expose the supernumerary teeth, using micro elevators to displace and remove the extra teeth, and in most situations, either minimal or no bone removal is required unless the supernumerary tooth is deeply impacted in bone, and those can be addressed as necessary. What is the best anesthesia for this type of procedure? Certainly IV sedation or nitrous oxide, known as laughing gas, provide the adequate comfort and experience for patients. Majority of patients who are having these procedures done are young, between the ages of perhaps 7 or 8 until the adolescent. So it's important to have some sort of a sedation anesthesia for their maximal and optimal comfort. Here's an example of a lower supernumerary teeth. Again, this patient showing 3 teeth that were formed in between the lower canine and was causing delayed eruption of the permanent teeth. And this is what they look like. Again, they're usually small, peck-shaped teeth that resemble a structure of a tooth, but they are missing the actual anatomy of real teeth. So here's my tips on how to diagnose and treat supernumerary or extra teeth. First of all, it's most important to have accurate diagnosis with the proper imaging. A cone beam CT scan is absolutely necessary for proper diagnosis, proper localization of the supernumerary teeth, and also provide the best approach for their removal. It's really important to have a close and a clear communication between the treating doctors. Often a pediatric dentist is involved in the initial diagnosis, or an orthodontist, and of course an oral surgeon that is often part of this team to provide the surgical solution and removal of the supernumerary teeth. Timely removal is an important factor. It's important that these are diagnosed and treated in a timely fashion in order to avoid blocking or delayed eruption of the permanent teeth. And of course, using minimally invasive techniques for removal of these teeth is very important, and close monitoring by the treating doctors in order to make sure that the teeth that have been delayed in their eruption or perhaps blocked are actually moving in the right direction and being erupted eventually and come into the mouth. So, if you have noticed delayed eruption of teeth or crowding during childhood years, it's important to see a pediatric dentist or an orthodontist for an initial evaluation. And if supernumerary teeth are noted or suspected, it's important to see an oral surgeon for a timely removal and its management. Good communication, proper imaging for diagnosis, a gentle and minimally invasive technique, and the right anesthesia approach are all the key ingredients for treating a child with supernumerary teeth in the most comfortable and quick healing fashion. I'm Dr. Ryan Kazemi, and see you again soon on our next Hints and Tips in Dentistry.